Thank you, Chair, and thank you, Co-Chair. Members of the High Table, Excellencies, distinguished guests, ladies and gentlemen. Let me add my voice in thanking the United Nations Secretary General, His Excellency Ban Ki-moon, and the entire United Nations family for convening this high-level meeting to provide another platform for the 3 countries that are most affected by the Ebola virus disease to share their experiences, progress made so far in the fight against the virus, and to further engage the international community on the health system's rebuilding process. Since the last World Bank World Bank Summit, Sierra Leone has continued to make steady progress on both fronts. That is, on the fight against the virus itself and on the recovery process. On the fight against the Ebola, I am pleased to report that the disease is now confined to only 3 out of 13 health districts, 2 districts in the northern province of the country and in the western area. 10 health districts remain free of the disease, and some have been so for months now. However, our strategies, such as quality surveillance, infection prevention control, safe and dignified burial, deepened community engagement, cross-border collaboration remain in place. On the recovery, the country has, since the World Bank Summit, developed a 5-year health sector recovery plan built around 5 pillars. These are patient and health worker safety and the restoration of essential health services, particularly those related to reproductive, neonatal, maternal, and child health services. 3, human resource for health, community engagement, surveillance, and information. All 5 pillars are important for the recovery, but because of the difficulty in predicting what can happen over a longer period of time, say over a 5-year period, especially in the area of funds flow, coupled with the urgent need for urgent prioritization and sequencing of priorities, we have divided the 5-year plan into A, an early recovery phase, B, a recovery phase, and C, a resilience phase. The early recovery phase is designed to last for between 6 to 9 months and is now in the stage of implementation. Its focus is on the first 2 key priority areas. That is, ensuring facilities are IPC compliant, have available water supply, as well as sanitation facilities. And 2, on the restoration of essential health services. On the issue of ensuring our facilities are safe for both healthcare workers and patients, I am pleased to report that the rate of facility-acquired infection has dropped significantly over the last 3 months. On the important issue of restoring essential health services, I am again pleased to share with you that all our public health facilities, from the most basic peripheral health units through to the district general hospitals to the major referral hospitals, are open to patients. We have successfully conducted 2 rounds of immunization campaigns, and a 3rd round is underway. We shall, as soon as possible, launch the district capacity strengthening project to strengthen the capacity of the district health management teams to deliver the basic package of essential health services. The expectation is that by the end of the 6 to 9 month period, we would have restored the health system to the pre-Ebola level, in addition to achieving and maintaining a resilient 0, putting us in a firm position for the next phase of the recovery, which is the 1 to 2 years. The implementation strategy of the 5-year plan is such that one phase merges into the other, so that there is a smooth transition as we move from one phase into the other until we eventually merge into our agenda for prosperity, which is the government blueprint for the economic development of the country. Excellencies, distinguished guests, ladies and gentlemen, I am pleased to report that All of the above developments are happening with the full and active participation of our health development partners, civil societies, national as well as international NGOs, non-governmental organizations, to whom we remain grateful. These organizations will continue to play an active role in the recovery period. Because of the strong partnership with existing partners, both donors and implementing partners, more and more new players are developing interest to support us in the rebuilding. While this is good in many ways, it also presents to us the additional task of coordinating our various activities to ensure harmonization and alignment of priorities. As a show of our commitment to the basic principles of partnership, alignment of priorities, harmonization, mutual accountability and transparency, and managing for results, we have, as recently as last week, launched the Service Level Agreement. The Service Level Agreement is meant to guide us all, donors, implementing partners, and beneficiaries alike, in our new ways of doing things, so it does not become business as usual. One of the major lessons the West Africa Ebola virus disease outbreak has taught us is that the world has indeed become a global village, and as such, the global health system is only as strong as its weakest link. A weakness in the health system in any one country represents a threat to global health security. As we have all come to the realization that the only way we can stop the world from witnessing such a human tragedy in the future is through the building of resilient national and subnational health systems, my appeal to all of us is to shift our ways of doing business from merely supporting health systems, which is what has been happening in the past, to building strong and robust ones. Whereas health system support improves outcome primarily by increasing inputs, for example, procurement of bed nets, medicine, etc., health system strengthening is achieved by identifying major health system performance drivers like policies, regulations, organizational structures, relationship across health systems, building blocks, and adopting a more comprehensive approach to them. Finally, on our part, as a government and as a country, we are committed to doing everything that is dependent upon us to achieve this objective. We count on the continued support of all of you. I thank you for listening.